Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Cranioplasty. Introduction. A hole or soft spot in the skull may allow the brain to be hurt in a fall or accident. A large soft spot may change the appearance of the face or head. Doctors may recommend surgery to repair a soft spot in the skull. Such surgery is called a cranioplasty. If your doctor recommends surgery, the decision whether or not to have surgery is also yours. This patient education module will help you understand better the benefits and risks of this surgery. Anatomy. The skull is a large bone structure that protects the brain. It is covered by skin and hair. Inside the skull are the brain and many nerves, including the top of the spinal cord. The hard skull helps protect the soft brain from being damaged by blows or shocks to the head. Holes in the skull may occur in the front of the head. Holes may also occur in the side or the back of the head. Symptoms and their causes. Holes or soft spots in the head usually result from injuries or earlier surgery. However, soft spots may also be present at birth. If people have a hole or soft spot in their skull, the skin is the only remaining protection to the underlying brain from injury. If you have a soft spot and you have an accident where an object hits the soft spot, you may suffer damage to the brain. Because the brain directs the working of the entire body, damage to the brain could have many different bad effects. Also, large holes or soft spots in the brain can change the way the head, forehead, or face looks. Cranioplasty surgery to repair the hole may restore the natural shape of the head and protect the brain from injury.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Alternative treatments. Wearing a helmet similar to that worn by a motorcycle rider may provide some protection. Such a helmet may be cumbersome and impractical in some situations. Your doctor may recommend an operation to repair the hole and restore the natural shape of the head. Surgical treatment. This operation is usually done under general anesthesia. Before the operation, the head is usually cleansed and the hair clipped around the edges of the soft spot. The skin is cut and moved aside to show the bony edges of the soft spot. The soft spot will be replaced by something hard, either bone or, more frequently, a medical-grade plastic. The plastic has a putty-like consistency which will later harden. Soft putty-like plastic is placed in the soft spot and fashioned to fit the right shape. The initial plastic consists of a powder and liquid. It takes about 15 minutes after mixing it for the final mixture to harden. During that time, it is molded to fit the soft spot. Small holes are made in the edges of the plastic plate and in the edge of the bone around the hole in the skull. Medical wire or nylon thread is used to fix the plastic plate firmly to the surrounding bone. Metal plates can also be used to hold the cranioplasty in place. Once the plate is firmly in position, the skin is closed. Your doctor will tell you how long you are likely to stay in the hospital. This depends on several factors, such as your age and medical condition, and will probably be 1 to 3 days. Risks and complications. This operation is safe. There are, however, several possible risks and complications. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery.
Risks of general anesthesia include nausea, vomiting, urinary retention, cut lips, chipped teeth, sore throat, and headache. More serious risks of general anesthesia include heart attacks, strokes, and pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medications. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. It is extremely important to let your doctors know if any of these symptoms occur. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs.
Some of the risks are seen in any type of surgery. These include infection, deep in the brain or at the skin level, bleeding, a skin scar that may be painful or ugly. In the case of infection, the repair materials may have to be removed and the operation repeated in a few months. Other risks and complications are related specifically to this surgery. These again are unlikely, however, it is important to know about them. There is a chance that the doctor may not be able to achieve the desired shape of the skull, nor the old shape. There is a very slight chance of injury to the brain during this operation. Such brain injury could cause bleeding or strokes, which could lead to weakness, seizures, or paralysis. After the surgery. After the surgery, you will keep on a bandage for several days. Later, when you visit your doctor, the sutures or staples will be removed. Your doctor will tell you how long it will take before you can go back to work. This depends on your age, type of work, and medical condition.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Surgery to cover soft spots of the skull protects the brain from injury and often leads to a nicer appearance of the head. The benefits of restoring the normal shape and protection of the skull are great compared to the small risks involved. However, as you have learned, complications may still happen. Knowing about them will help you detect them early if they happen.
Thank you for using Explain.